Okay. Uh, hello everyone. This is our next session for the day. We have Dr. Prachi Gajjar and Dr. Parth Parmar, both of whom finished their medical school and home country residencies from India, very coveted and competitive residencies. Dr. Prachi Gajjar pursued her residency in dermatology, and Dr. Parth pursued his residency in ophthalmology. However, both of them switched their specialities to internal medicine and successfully couples matched in the United States this year. And they're of the firm belief that if they could do it, anyone can. So we welcome you both and we request you to share that incredible and very interesting story of yours. Thank you.
Hi, first of all, thank you for inviting us.
Yes, thank you.
Yes, good evening, everyone, and happy Halloween in advance.
Happy Diwali.
Happy Diwali. Okay. So, just my short intro. I completed my med school in 2006 in a small town in Gujarat, India, Bhavnagar, and I completed my post-graduation in dermatology in 2019. After that, immediately I started preparing for my USMLE steps, and it took me 2 years to complete my step 1 and step 2. So in 2021, I came to United States to complete my rotations and applied for the match. And in the first match cycle, we could grab like 7 to 8 interviews, and we matched at our top choice.
Yeah, the same story goes with me as well. So I also completed my MBBS in 2016. Then after I did my post-graduation in MS ophthalmology, completed in 2019. Then after we completed our USMLE steps and we matched last year, like this year.
That's a very brave decision, I would say. If you could highlight why it is that you decided to make the shift from your country and then to the US, considering that you did go on to pursue your residencies.
Like there are many factors, but one main factor was that even after doing post-graduation in India, the waiting period to get settled down, to start earning profit after investing in your private practice, that was actually longer than this entire USMLE. So because as a dermatologist, if I start practicing in India, it will require an investment of 2 to 3 crores if I decide to, establish in a big city, metro cities. And then again, it will take 5-10 years to recover from that loan and start earning my profit. So comparatively, I compared it and I felt that doing USMLE and residence in United States, and then whatever compensation packages that we get, that is earlier as well as easier in United States. And although money is not a big factor, other than that, I like the healthcare over here, the healthcare system. Like patient is like God for the doctors over here in United States. They get to decide everything, they are given the preference, and even lifestyle wise and everything, I felt that this is a better option for us. So we didn't we didn't do any further fellowships in our respective home country residency, but instead we decided to opt for USMLE.
Yeah, and one of my experiences is that during 2018, when we were doing our post-graduation in India, so we had a chance to come to the United States for a conference. And at that time, we also noticed the healthcare system in United States, which was quite different and more like improvised version of the medicine that we were doing in the India. So that was one of the forcing factors to do USMLE for us. Yeah,
we had a chance to interact with few medical students in that conference, and we came to know how training over here is different. It's more systematic, so that's what we thought.
Yeah, those are very good reasons. Like you mentioned, a lot of us here are also international medical graduates. We're currently in the process of, we have applied, we're awaiting interviews and everything. And like you mentioned, a very important point that in the United States, the patient is the god.
Yep.
Yeah.
And where we come from, it is the doctor who's put on the pedestal.
Yes.
So it's a very different way of healthcare system here, which one needs to realize as an IMG. So
Yes,
that's
that's
very
true.
interesting.
Mhm.
As someone who has absolutely, I would not say zero, but like a lack of knowledge about the couples match system, could you tell me a couple of things? The first of which being, was it a conscious decision to go into the same specialty?
Yeah, so like we are married for like 4.5 years. So basically we wanted to be together, and internal medicine is like, it has maximum number of seats, they give to IMGs. So that's the reason we both chose internal medicine. And somehow, like, I felt dermatology and internal medicine, they both share many similarities, that they both are diagnostic branch. So that's why we decided to go for internal medicine together. I mean, and you want to know more about the couples match. So yeah, basically, I would definitely recommend you to watch my video on my YouTube channel. My channel's name is Prachi Gajar USMD. I have described it over there. So basically, you tick yes for couples match in your IRAS application, and you apply to similar programs.
Mhm.
You may or you might not get interviews from the same program. You can just insist the program. Like, for example, if I get an interview and Parth doesn't, I can insist them. I can request them that you go through his application. If you find it eligible for your program, you can give him interviews. We were open for both the options, but somehow we were able to grab more common interviews by requesting the program. So out of 8, we had 7 common interviews. And then in February, when they make the rank order list, at that time, we have to like rank our programs together. Like, for example, if we have 8 interviews each, then we would make 8 into 8, that is 64 combinations. Okay. And apart from that,
16 would be
yes,
one would be no match for 8 programs, and I would be no match for another 8 programs. So 64 into 6 plus
so
16.
81. Yeah. No match was basically that I was ready to even sit home if he gets matched. If I get matched, even he is ready to sit home. That is no match. And for me, I would opt a program.
But those were the last
Yeah.
preferences, not the first.
So that is the main game. The final game is in the rank order list. So we made 81 combination. The algorithm, the match algorithm will go through this. It will scan all the combinations, and wherever it will find us both matched, like programs have selected us together, program should rank us together as well.
That together means like just one up and one behind. Like if she is
consecutively.
Yeah. So like if I have performed very well in the program interview and he has not, the program will rank me up, but the program will rank him very down. So then you cannot match together. So you have to give like a similar kind of performance, and you have to remind the program by sending letter of intent and interest.
Yeah, so during interviews as well, we used to ask the programs like, what are your preference for the couples match? And if they are like open for the couples match, then we would like to like talk about each other, that I have a spouse who has this kind of profile. If you like, then you can give her or him the interview. That's how we used to ask for.
Wow. So okay, so just a couple of clarifications for my own self. So you mean to say that suppose a program's preparing their rank list, a couples match, for that to happen, they have to rank you 1, 2, like together. It cannot be 1 or 7 or 1 or 5. No.
It can be like within 10, it's fine.
Oh, okay.
Each program will rank approximately, 50, 60 candidates out of 200. They might interview 200, but of that, they might rank just like 50, 60. So we have to be around like close, within 60. Yeah.
We have to be close.
Yeah, exactly. Like either 10 points difference.
So it should be more proximal for you to be. Okay.
So it's likely that in between 9 people would rank other programs, and if she is first and I'm on 10th rank, then we would get matched.
Yeah.
Okay. That is interesting. So how do you remind those programs? Like,
so basically, so basically sometimes we both interview on the same day. But sometimes my interview will be before his interview. So at that time, we both will remind, that they'll ask you why you want to come to our program. Why will you prefer us? Then I would say that, this program is interviewing even my husband, Dr. So-and-so. He's going to interview you on this date, or he has already interviewed on this date. Then they will say, oh, okay, I remember him. They'll recollect, And similarly, when Parth is interviewing them, he will again remind them that you remember she's so and so. And sometimes two of the program we were on the same day, same Zoom session. We both were candidates, so they recognize by the background.
Right.
That okay, the other candidate at the same background, you look like spouse or from the same family.
And before rank order list also, we used to email them that we are the couple and we have applied together in this match season. So if it is possible, then
kindly consider us together. And also, while we updated step 3 to our programs, we again mentioned that, what we are doing couples match.
Okay. So
basically our couples match information comes in the personal information section of the ERA CV, and you have to like remind them because it's like common for each of them. So you just have to remind them.
So, the next follow-up question would be, is there any disadvantage to a couple match? Like, did you feel there were any challenges towards, applying as a couple than individually?
So we were just afraid of being like separated because of this couple match, because you have more risk of going unmatched or like staying separately in this kind of match compared to couples match. Compared to separate match. So that was the one of
the thing is that it's not, some programs may prefer couples, some might not. So few of the programs who don't like couples, they won't give us interview together. Okay. They will only send him interview, they won't send me.
Specifically
vice
like
versa.
New York and New Jersey, which are the busy programs, they won't prefer the couples.
So the reason is that if a couple is working in a hospital, they have some family issue, then they both will ask for the leave together. They both will have holidays together. If one person is having any issues, any problem or any conflict with another colleague, then they might have bias with their husband, their spouse as well. So some programs, they won't consider them, so they won't send interview as well. So it won't go forward. And the other programs who like couples, they will definitely consider you, but they should like you both, at the same time. It's not one or the other.
We were definitely fortunate enough to get 7 in common out of 8. So that was one of the good things that we had.
Yeah. I think, like you mentioned, that some particular areas in specific do not prefer couples. It's a thing that even we have noticed, especially now during the interview season, that some smaller or places that are not very mainstream, they do ask you if you have any family ties, and because they prefer people who stay back. And places in New York or bigger programs, they prefer more people who'd be ready to spend those kind of work hours.
And one another thing that we always mention to one of our programs, like we got separate interviews in New York, New Jersey programs. So we would like to mention them, like we have our spouse in New Jersey program
interviewing
he
in the
interviewing
same
the New Jersey program. So we would be in the nearby location. So it's good for me to stay in your program when he is nearby me.
Right.
And the combinations which we had made was like first 7 combinations were like same programs for both of us. Then we would select nearby in New York 2 different programs. Then we would select 2 neighboring states, and then at last 2 far away states where we might have to take flight or we'll have to drive for a few hours. So that's how we made the rank order list, and we were ready for anything, even for the no match.
Could you talk a little bit more about the no match thing?
So basically the thing is, in any match cycle, they wouldn't select anything other than what you mention in your rank order list. Okay. So whatever programs, whatever combinations you make in your rank order list, that only the computer will scan. Of course, it will not do anything out of that, So we were ready for one of us to sit home, another doing residency, but we wanted to be together, So those were our last options. When we finished all the faraway combinations, then one was ready to sit, the other was ready,
So the logic behind
Yeah.
is that if she has interviewed 8 programs and no one of them is ready to take her, but
Him, yeah.
either of us,
Yeah.
yeah. So the program will be like one of the 8 programs would be ready to take either of us. So it would be go in that
Order.
rank, yeah.
Yeah. So it will just scan whatever is in the rank order list.
Right.
So 8 programs selected him, but not me. Then it will be no, 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 no for me. All the 8 names we would mention of his program. So it will scan wherever it comes for him. It will be match for him and I'll be no match. Then comes my programs and he's no, no, no match. So then it will go.
Just for an example, if we are getting some vibes from a program that they are not preferring the couples, so we would rank that program last, like they are not preferring us, so we would not rank them higher. So in that case, we may have a chance of getting no match because they would not like our talk of about like couples match. So they would not rank us even.
Yeah.
Okay, so that was basically we already find the entire season pretty stressful. It was double the amount of stress for you both.
Yeah, actually. But now double amount of enjoyment and
Oh, absolutely.
Double the benefits.
I'm sure it's totally paid off.
Yeah,
So,
it's totally paid off, So
yeah. Another question, and this is more so towards the preparation for the steps, because you guys prepared after your residency. How was that? How difficult or easy did you find that part, going back to, the syllabus for step 1 and then getting into the grade of studying?
So the one thing that I would like to mention that we were like scholars in our MBBS preparation. She used to get first rank, I used to get third rank. So overall our knowledge about the medicine was quite fresh. And then after once we decided to do this thing, then after we were like giving more time to this thing in addition to our practice.
So we were doing part-time practice basically. We were not doing full-time practice while preparing USMLE. That's how we could, dedicate our time.
If we are like planning to give exam in next 3 months, then we would study more for our exam compared to giving more importance to our practice. So that's how we did.
And it was totally, difficult because we had lost the, concepts. First year MBBS, definitely I lost the contact with anatomy, physiology. So it was hard, but with first aid and all those videos, I could definitely, I took time, basically 2 years. Maybe if I was a fresh graduate, I would have taken less time.
In 1 year, we would have cleared the steps, but.
So that's the thing.
And you both took your step 3 before the rank order list or before the application?
So the thing is that if you want H1B visa, your step 3 should be done before December. Okay, most of the programs, they want your step 3 score by like before February. Before February. The other advantage of step 3 is that while making the rank order list, they might compare all the candidates. So if you have a step 3 score, they'll consider you a complete candidate compared to other candidate who has not given step 3, because while doing residency you have to take leave for your step 3 exam. You specially take a lighter rotation to read for step 3, and if you fail, then program has to suffer. So they prefer a candidate who has already done their step 3. So not only H1B visa, but even in rank order list they may put you higher,
right,
to give them step 3 scores.
Okay, so the next question is for Dr. Parth, because I think you finished your residency in ophthalmology, right, in India. So how did you justify the switch from, I think that would be considered more of a surgical field, and then you came into internal medicine here? Because a lot of our viewers, they often ask this question to us. So what was your experience like?
Yeah, so one of the major, like my life events is that I lost my father because of some cardiac illness. So medicine was always one of my choices besides ophthalmology. And definitely I won't be like going in that direction that I always wanted to do internal medicine, but it's definitely a fact that getting ophthalmology in United States, it's quite a bit tough. Even for the US graduates, it's always harder to get into this ophthalmology. So it's definitely hard for me as well. But medicine was always one of my choices besides ophthalmology. So yeah, it's not that much difficult for me to switch from opthal to medicine.
Basically, he wanted to dedicate his life to his father,
Yeah.
whom he lost in heart MI. So I think medicine is the way where he can, save lives.
Thank you so much for sharing that. And I'm really sorry to hear about your father.
Thank you.
Um, Another thing that comes to mind then is that as I am an international medical graduate, and as graduates, something that is really ranked for us is the YOG, the year of graduation. For you, was the year of graduation counted from when you finished MBBS, or was it counted for
Oh,
when you finished residency?
Internship.
Like
Day of completion of your internship.
2016 was our year of graduation. Yeah.
So the internship, basically, the last day of your internship is the year of your graduation. We were 5 years old graduate. So
Right.
most of the programs, they have 5 or 3 or
Mm.
no, either
Yeah.
no cutoff,
So,
So
did you think that that was a major, it played a significant part in your application?
yeah, so there were many challenges in our profile. Basically, I had average score in my step one.
Mm-hmm.
I just scored like 230, and in my step two also 245. So they're not extraordinary scores. And plus, I was a 5-year-old graduate. So plus, third thing, I was switching specialty.
Right.
These all were my challenges, but I think that interview skills plays a major role, and how convincing and genuine answers you are able to give them. It's just like advertising yourself, basically. It's just showing yourself, showing how you present yourself, basically. And you have to convince him that you are going to shine out of all the 200 candidates that they are interviewing.
Yeah. So basically, we had done our residency, so we would give more positive points of doing residency compared to like wasting our years in old YOG. So
Yeah.
that's how you sell yourself.
Right. Yeah. That's a very good point, actually. Um, okay. And how did you go about finding US clinical experiences? Did they come by easily, or did you go via agencies? Which one was it?
Few of them were with agencies, and few of them we contacted directly to the program. Like, we are this profile. Do you want us to, like, do you allow us to do the observership or rotation? So they used to do all
Yeah,
of
so it was definitely tough for us. I was doing my rotations during the COVID time when everyone had closed, their ways for the IMGs. So two of them I did through agency, and I would say hands-on is preferred over observership. We got one observership in University of Kentucky in
Mm-hmm.
cardiology department. Although it was a university, we were just observers. So as an observer, they cannot write you a strong letter of recommendation because you are just sitting in the, standing. You're not even allowed to talk to the patient. But so it's hard to show yourself in observership. But we did one externship in a private practice, and other was in a inpatient hospital, that is Southampton Stony Brook Hospital. The other advantage was that the third rotation which I did in Stony Brook, Southampton, we got interview from there, both of us. So that's the advantage of externship.
So it was like we just completed our rotation and med season started.
Yeah.
So they provided us the interview.
So I think your experience was still fresh in their minds then.
So basically, the programs with residency, they
Mhm.
will provide interviews to all the, students who have rotated there,
Right.
including medical students, observers, externs. Most of them, they will give interviews, and then they will compare. So
Right.
Performing yourself like in a better way during those kind of rotations is a good idea than struggling for the interviews.
yeah.
Okay. Yeah. That makes a lot of sense, actually. Um, could I also ask you what do you think were some special or very targeted things in your applications that really helped? Like, we all know that you had conventional red flags. You according to the programs, your YOG was more than 5 years or just about 5 years. You were visa requiring IMGs.
Exactly.
And again, I think you had already finished your home country residency. And while that I think some programs rank that to be a very good factor, some don't.
Yes, basically, yeah, it was hard. So although with all these red flags, they ranked us higher.
Right.
First was because of our interview skills.
Mhm.
So we had practiced a lot for interview, and we didn't think about money at that time. So we interviewed with many professional, doctors, residents as well as doctors. More than the colleagues who are applying for match, it's better to do mock session with the one who have experienced the entire math season. So like the residents or the attendings, or any professionally with someone. So that helped us to prepare very, very good answers. Second was when they asked us that what are you doing right now, we would say that we are right now preparing for step 3, and my dates are in December, and I'll be updating you the scores in around Jan. So that was another plus point. Because programs, they like it that you complete all your steps before coming before July. So I think these two things mainly helped us to be on the top priority for all the programs.
Right.
Yeah.
Okay. And you know how some specialities in the US are more geared towards, like they're more IMG friendly, supposedly. Are the same specialities also IMG friendly for couples match, or some of them are not so much when it comes to couples?
Basically, it depends on the program more than the specialty. If the
Mhm.
program and the program director is comfortable taking 2 people from the same family, and it all depends on both of you, like you both should be a very strong candidate for the program. So
Right.
it's like that, any specialty or
it's
any
not specialty specific, but it's more program
Program
exactly.
specific.
And also candidate specific, I must say.
Right. And
Yeah.
because you touched a little on interviewing skills, what would be your advice to candidates, couple, or even, normal ERAS applicants?
So what I did was that first I prepared, like there are a few 10-15 common interview questions.
Mhm.
I have posted them on my Instagram page, that is usmle.derm2im. Please check it out. So there are a few like 10-15 common questions. I had prepared my side of story on my own. And then I started taking mock session, as I said, with professionals. Like there are many doctors available even on Instagram, just like my page, even I'm doing interview mock sessions. So similarly, Dr. Zishan is also doing it, So there are many such doctors. So I started approaching them. I started taking their dates because not everyone is free. They all are practicing doctors in the United States. So they'll give you time like within 15 days. So you have to be very early on this, on this stage of preparation, and keep on doing mock session. And daily we used to even practice with each other. Like we would just refine our answers till the last day of my interview, and then I printed my final copy of my questions, and before every interview I'll just go through my all those answers.
Right.
It's not that you may ask those type of similar, they might even ask you some awkward questions, but you should be ready for anything, and your answers should be short,
Mhm.
precise, and genuine.
Yeah, so
Yeah.
brief and to the point answers they want from you.
Mhm.
And they don't want just like routine answers. Like one of our program associate program director was asking 2 days back that I asked one similar question to all of my candidates this time, that what if I give you some special power, and what would you do? Yeah, what would you do with a special power? So everyone was answering like I would do like heal people, cure all the peoples in the world. So that's not the answer they want. They want something unique from you that is like specifying you.
Yeah.
So yeah.
He also mentioned that he liked one answer.
Yeah.
One of the candidates said that if I get superpower, I like to read your mind. Whatever you are thinking about me, I just want to read that.
Whether you are going to rank me or not.
So that was a realistic answer,
Yeah.
Yeah.
So that's the thing.
So when they want a funny answer, you should give the funny answer. They want a like real answer, you should give the real
So
answer.
basically it's just a conversation just like this, like I'm talking to you, you are asking me questions and I'm answering.
Yeah.
So it's just a genuine conversation. So don't make it too serious, and don't make it like our exam, like our practical exams which we gave in our medical school, all those questions. Don't make it like that way. So
I think one challenge that especially people from other countries face is that they have not had to give interviews, not in the medical field at all.
Yeah.
I think, like you mentioned, the max interviews we've given are oral.
Viva.
Yes.
We just gave vivas in our medical school,
Right.
and they were scary actually. So
Yeah. You're
that's
right.
how we are comparing this with that, but it's not so.
But I would also say like doing more clinical rotations and getting more clinical exposure from the US physicians was one of the factors that we were giving good answers.
Yeah.
Because,
And one another example is like I was switching specialty from dermat to internal medicine. So instead of giving an extravagant answer that, I want to do this and that, I would just simply say that I always wanted to choose internal medicine, but the ranking system and admission system in my home country is different. Like, it's based on ranks and reservation. We don't get to choose what we want, but we are given certain specialty based on our rank. So at that time, dermatology was the thing which I was offered, not internal medicine. So even while doing dermatology, I definitely enjoyed dermatology. It's not that I hate them, but over the years, I experienced that I want to do something more than skin, just the external factor. I want to treat patient internally as well as externally as a whole. So without going further into my dermat career, I decided to apply for internal medicine in United States. So that is something, realistic answer.
Yeah, I think it matters the way you present the answer, and secondly, what you say. It should not come out all jumbled up.
No.
And yeah, like you mentioned, the best way to move forward is to take guidance and to seek help and do
Yes.
mocks. Yeah. Okay. Thank you. And did you also have any research experience, or is it encouraged? A lot of it,
Yeah.
or
Any number of research is encouraged,
Mhm.
but it's not that if you have zero research, you won't get interviews or you won't get selected. That's not the criteria to give interviews or to rank you high. So that's a misconception. Interview is just an add-on point.
Right.
Research is just an add-on point. If you have some research, you'll have something to talk about in the interviews.
Yeah, they would definitely get a point to talk about. She had some around.
I had eight.
Yeah.
I ate research because I did home country residency. So everyone would ask that, which one was your favorite? Tell me something about your research. I think that was a common question in all the interviews.
So most of the programs are research friendly. So they just want to know your interest about the research. So if you are not having any research, they won't it won't harm you.
Yeah.
But definitely they would like to know more about our preference to research. So whether we'll be as a resident physician will be doing research or not in that program.
And see, most of the community programs, they do not do that much research in United States. So even the program which I matched into, they are not into research. So that doesn't make a difference, even if you are into research or not. Okay. That's not a deciding factor basically for them.
Right. I mean, if you have it, it's a very good thing. But if not,
Definitely.
it's not a moot point.
Yeah. So they are selecting you for clinical work, right? Not
Right.
for research. So they're not concerned about that.
Right. Makes sense.
Yeah.
And one of the questions that just came in was, is it for couples match, is it necessary to opt for the same branch, or you can also opt for different branches?
You can opt for different branches as well.
Okay. And how easy or difficult would that be? Are you aware of it?
Thing is, if you apply to different branches, the two program directors, they won't come into contact with each other.
Right.
You just have to mention your PD that I'm going to rank this program high because even my husband is interviewing in family medicine in the same program.
Right.
You can just show your family ties over there.
Mhm.
Otherwise, family medicine and internal medicine PDs, they are not going to talk with each other. That I interviewed this candidate, you interviewed that. So it's a separate department. They don't interfere with each other, but it's just a family tie which you can show in your interviews.
And in for couples, even it's not compulsory to be husband and wife, even fiance, best friends, male,
Cousins,
female cousins, all can be couples match.
Oh, I didn't know that. That is so interesting.
Yeah.
Yeah. Okay.
You can also decouple anytime. It's not that you have to, if you can choose couples match anytime before February.
Yeah,
Oh,
because
so you can unlink your applications.
Yes.
No,
basically till February, you can do anything. We had picked couples match in February. Okay. In Jan. In Jan, we had selected couples. Before that, we applied individually because we were just afraid that few programs who don't like couple, they won't send us interview at all. So we didn't want that, at least even if one gets interview, it's better.
And it is also better to be an individual till the rank order list is made, because it shows that you are open for separate match as well as couples match both.
Okay, that is a new piece of information for me.
Everything what is in the personal information in your ERA CV can be edited before rank order list.
Now that you've gone through this process, and because you mentioned that in the beginning of the application, you both applied individually because you were scared. I guess also because there's not a lot of information that
Yes.
is available.
Yes.
Um, like personally, we don't know of many people who've applied as a couple, especially as international medical graduates. Um, Now, if you were to advise, people in this cycle, would you say that it'll be better if they're already married or planning to get married or, even best friends? Is it easier to apply as couples, or would you say it's okay to apply individually?
It's okay both the ways, but if you have a special preference to be together, you should
Mhm.
definitely apply as a couple. There is no harm basically. We didn't find any harm, but we got the additional benefit
Right.
because individually I had only 3 interviews
Okay.
and Parth had around 5 interviews. But when we talked to each of our programs, different programs that consider my spouse, after that we grabbed 8 interviews together. So we both got advantage of couples match. We got more number of interviews, more common, and every time like we would remind them. Once during my interview day, I will remind them about Parth. During his interview day, he will remind them about me. So like program kind of remembered us as a couple. That that couple we both interviewed, they were so and so. And then
Right.
during a letter of intent step 3, we would again send them emails. So like I think they might have specifically remembered us as a couple, all the programs which we interviewed.
And even as a couple, you would have more chances of making some rank order list, because if we were separate, then we would have ranked just 8 choices, but because of the couple thing, we had made 81 choices so far. So your individual rank order list is also considered in the couples.
Yes,
Yeah.
exactly. So
Oh,
couple is actually both of the thing. Individual I have 8, but with him I have like 61,
so it's
whatever.
almost like having two rank order lists per person.
Exactly. So it is one and the same. Actually, there are
Right.
additional
And
benefits of being
benefits
a
are
of
more
a couple.
than being
As
alone.
I said, being alone, I would just get 3 interviews. That too, hardly 3 interviews. So, you know,
Yeah, yeah. I think one of the questions that came in is, does applying as couple increase the chance of getting interviews at the same place? I
yeah.
think
So
you
yeah, so
mentioned
that's
that.
what I said. We both grabbed each other's interviews. So
Yeah.
out of 8, only one program was not ready to give as a couple. Not one, but 2. One my individual and one he got individual program. So
Mhm.
2 programs they were not happy with couples, so they didn't give each other interview. Just
And
one and
in
2.
those kind of programs, you would even not mention anything about the couples.
So
You
they had
just
mentioned in their website that we don't like couples. So
Oh,
like
so there are programs who also mention that.
yeah.
we don't prefer couples, like that way they mention.
Then in that case, how did you navigate that? Like,
So
as
in
I,
that
you
case,
applied
as he
together.
said, yeah, as he said, it was in New Jersey,
Mhm.
which they didn't give me any interviews, but they sent him interviews. So he would say that still I'm going to rank this program high because my wife is interviewing in New York. So
Right.
definitely New Jersey, New York is just 30 minutes away. So I would
Correct.
always rank this program high. I would always stay there. You have to make the program feel that, you are my number one choice.
Yeah.
Whatever.
That they're the ones you're thinking about.
Exactly. The program also knows that you are faking it, but you have to say that.
It is the game.
Yeah, it
Uh,
is.
Another thing that I don't think this applies to you, but you probably will have better insight into it. Suppose a couple is applying as a couples match, and one of them is applying to family medicine and the other is applying to internal medicine in the same program, like in the same place. What do you do in situations where one of the specialities is, it's a very strong program there, but the other specialty is a weaker program?
So it depends on the couple. What's their priority? They want to be in a good program or they want to be together. They want to see each other at least daily, although the program is toxic. So it all depends on I have a colleague of mine. For them, being in a good program was a priority.
Right.
So they made their rank order list in such a way that they had put good programs together in their combinations. So they match differently at
So
different
yeah, it
places. Yeah.
depends on the priorities. So we had a priority of being together and getting good visa. So that's how all the people think.
Yeah. So if you're
Right.
ready to be away from each other, but you want to be trained in a very excellent program, so you make your rank order list that way.
Mhm. I think this it must have been a good decision for the two of you, because coming back, especially residency, we all need our support systems.
Yeah.
Do you think that it has helped being together in
Yeah,
terms of
definitely. Yeah. So see, if one of us is in a busy rotation, the other one who is in a lighter rotation, they'll take care of all the household, they'll cook or whatever. So you feel happy, you come home after your complete entire busy day and you find your house is sorted out, you find your food ready. So that's a definitely additional benefit. And you save a lot of money because you divide in your rentals.
right?
Yeah. Otherwise, if you stay in two different states, you have to pay the entire whole rentals, two different houses you're running. Plus, you will spend a lot of money in flights or driving the car to meet them, every 2 to 3 months. And you hardly get time, actually. You might just plan a weekend to see your
Right.
spouse. That's too less. You're driving 5 to 6 hours to just stay there for a day. So I think it's definitely advantage of staying together.
And another thing that I wanted to point out was, like, I'm sure your program, because you both have matched together, are there any challenges to being in the same program as a couple together, or it's all hunky dory?
So yeah, there is a rule. Basically, as a couple, you are not allowed to work in the same team.
Mm-hmm.
So sometimes the program might find it difficult making the schedule.
Okay.
We have, I think in our program, we have 5 to 6 couples. So out of 40 residents, 5 to 6 means 12 are couples. So they have to make their schedule in such a way that those 12, couples, they don't work in a same team. So
Right.
that's challenging for them. And sometimes, like, we are taking our vacations in Christmas. So two candidates will go at the same time,
Yes.
So we will plan it in a similar way that we both have our rotations together. We just get leave during our electives, basically. We
Right.
cannot take leave during ICU or floor duties. So that's how. So I think more for them, but they are ready to adjust. Not for the couple. It's not an issue for us. But yeah. But if the program is good, they will do everything for you.
So
They'll
it depends
adjust
on the
themselves. Yeah.
program overall. Yeah.
Yeah. And if they are not ready to help that way, they will not give you interview.
Yeah.
So
True. So that's good to hear that, programs can be that supportive,
exactly.
especially when I think, irrespective of the fact whether you match together as a couple or someone's doing it, it's very important to get matched at a supportive program at the end of the day.
Yes.
So did you have any specific search criterias when you searched or looked up your programs? How did you decide that, this place is looks more congenial to their residents?
So in that case, we used to do like after step 3, which programs are ready to give us the H1B visa.
Right.
And another thing that we would always search that was program website. Like if they are preferring the couples, if they are preferring our scores to be matched, then we would rank those programs higher than compared to others. But otherwise, people usually rank 250 to 80 programs, like they apply to 250 to 80 programs. So it is the same list that goes on every year. But when it comes to the ranking, then after it's more of programs criteria compared to any other
And it
things.
also depends where you want to stay.
Yeah.
Like, I didn't want to stay in a metropolitan city like New York and New
Right.
Jersey. So I had ranked all my New York programs at the last, because I've heard that New York programs are too busy and it's too costly to stay in New York. Like, I think 50% of your monthly salary will go into rentals and you won't save anything. So that was my preference, that not to stay in that big cities. Although public transport will be an issue if you stay in a small town like us. You have
Mhm.
to buy a car, but that's doable. You will be living in a little bit big house compared to all those metropolitan cities. So that was our preference while making the rank order list, basically. And also the visa. We would look at
Right.
the visa, the compensation, and we would also look at other colleagues, what kind of candidates a program is having. Like if they're having IMGs more, there are few candidates from my hometown, then I would ask them personally that what was their experience in this program, if
And
I know someone inside. Yeah.
if you don't know anyone from the program, you can always ask the residents during the interview time. So rather than just like chit chatting to the interview for to the
Resident
residents in the
meet.
interview, yeah. So ask some productive questions to them, like how hard or how easy to stay in this kind of program, how do you commute, how do you like manage your daily
Work-life
expenses,
balance,
work-life balance, everything you should ask them.
Yeah, that's true. Even the work hour was one of my criteria. I would look at the schedule even. I didn't want to exhaust myself by working like 10, 15 hours, So some programs say make you work more. So these all were my criteria, basically.
The thing that you pointed out.
Sorry to interrupt. One thing that you will feel the vibes during the interview. The way they ask you questions in the interview, you will feel how the program is little bit.
Right.
Like if they make you feel awkward, if they comment something awkwardly, then you will come to know that they are judging me just from the day one of my interview.
Absolutely, and that's a very important point. Actually, it's very important for us as candidates to see if we are wanted there.
Exactly.
I think we are so busy in trying to identify that, oh, okay, we got this interview and we have to prepare. We never sort of take the time to realize whether it'll be good for us there, because at the end of the day, we are spending a lot of years in that program.
Yes.
Okay. And another question, because both of you have had that kind of experience, program directors often have this misconception that old grads might find it a little more difficult to adjust with their younger colleagues.
Yes. Yeah.
So I think in their minds, probably because of conceptions or older experiences, they think that a bond would not be able to be made. How did you deal with that, or do you think it is true?
So overall, I would say like you have to convince. Every program has this kind of concern. So you would they would come to know about this from your CV, from your PS. So PS and CV will play a big role in this case, because you can show your abilities to mix with people in your PS and CV. And another thing is that you can always mention. We always mention that doing residency makes us we can make better deal with people, we can make better deal with patients, so that's how you can convince them.
So basically, I think they will ask you in the interview also that what do you think on doing residency all over again? So my answer would be that I consider myself a lifelong learner, and I'm here to learn internal medicine, not to be a boss or just to be I won't behave as an attending, because for internal medicine I want to learn it from scratch. So that is possible only if I coordinate with all my colleagues, seniors, although they are my junior. And so yeah, that's how we would convince them.
That's a beautiful answer, actually.
Yes.
And in terms of bonding with the colleagues, like your own residents, co-residents, how easy or difficult was that, or it was a no fact? It was not factor
even,
at all.
even like individual applicants are not of like, some of them are my age, some of like beyond my age. So it is not always the case that people who are like already done the residency are older than other people.
Yeah, so basically American students, they are of our age because they did their pre-med and then med school. So they are of our age. Basically only the IMGs, they are younger than us, but that too like 3 to 4 years. So that doesn't make a difference basically. Here everyone is same.
Yeah.
Because we all are learning from day one.
They would come to know about your thing when during interview as well. So when they ask such kind of question, and if you are giving convincing answers to them,
yeah, if you are sounding arrogant, then they will come to know that we cannot coordinate with him. So
Right. Yeah, makes sense. And in terms of going out or like, socializing, wellness activities, how is that has that been okay as a couple? Because there's also this misconception that if someone has a partner already, they are more busy during their lives and might not have enough time to socialize.
I think individual people are more busier than us.
no, it's not so. Basically, yeah, we enjoy all the occasions. Social. There were many social occasions in our program. Like we are just here for 4 months, but we attended around 4 to 5 social gatherings. In our festivals and everything. There was also one wellness get together, and we all enjoyed. So
Yeah, then that is very good to know.
Like individual people find their couple during their residency.
yeah, so it's either way. Either you enter as a couple or you exit as a couple. So,
I guess it is that stage of life.
yes.
Okay. And anything that what would be your biggest takeaway from your journeys? You both have had very, I think, very different journeys and thankfully and fortunately very successful journeys.
Mhm.
So what would you say was like the biggest factor out of it?
So just the biggest factor was like, although all you have completed everything, but just for newer aspirants, I would say that if you want to do USMLE, don't fall into the trap of doing home country residency. Although it looks attractive, but it's definitely challenging, convincing the program that you are switching specialty and now you are an old IOG.
Mhm.
So I would say that just finish it off as soon as possible. And if you are done with everything, you are a current like this match applicant in this year, then you should definitely work 101% on your interviews as well as step 3. They both are the determining factors for your match. So now once you got the interview, they will not look at your scores or your profile or your personal statement. They'll just scan through your ERAS CV and PS in like 1 to 2 minutes. So now the real game is your interviews. They will
Mhm.
remember you based on your interviews. On that day, they'll give you some scores. They'll put some scores because they are interviewing from October till Jan. They won't
Right.
remember each and every candidate, but they'll just put some scores or they'll put some 1 to 2 comments besides you, and they'll watch that again in February. So some of the candidates might fade away, from their memory. So to be memorable, you have to be very perfect and in your interviews. So the real game is interviews. If you are a match applicant, I must say.
I would agree with Prachi that if
Yeah.
you are planning for USMLE, don't fall in any other traps. Just go for the exam on like actual time rather than wasting the time.
Yes.
Right. Yeah. So, another thing that I would want to ask is that you mentioned the real game is the interview, irrespective of whether you scored high, whether you scored low. Would that mean that even if so, once you've got in the interview, that is all that should matter? Like you should you should keep it in your head that you're being considered highly.
Exactly.
Yes.
Yeah.
Okay.
So they have given you interviews only if you have matched their criteria, first of all.
Right. Mm-hmm.
So somehow you fit in their program's criteria. That's why you got the interview. Now everyone is same.
Right.
Now the real game begins. That how are you as a person? How genuine you are. They don't want to work with someone who is not so good to work with. So
Yes. Mm-hmm.
who is arrogant, who doesn't want to work. So that's how you want to
Like
show
I
yourself.
have seen certain people who have got higher ranks on their like this USMLE steps, but they are not that much friendly to talk. They are not that much friendly to work with. So if you are sounding like that during your interviews, then they won't rank you even if you are like 270s or 260s. So you have to make it sure that you are flexible enough to work with everyone.
And not only the program director, you have to be nice with everyone.
Yes.
You're the resident meet, even the program coordinator who just handles everything.
Yeah.
Yes.
You have to
Because
be.
during your residency you hardly meet your program director or associate program director. You will work with your colleagues, you will work with the
Different
nurses.
attendings,
Yeah,
yeah.
everyone else would be different, so you have to be like friendly with everyone.
Another thing that comes to mind because you mentioned interacting with the residents, especially during that Q&A session that one gets during interviews. Um, the Q&A session during the interview time is hardly, I think, 30 minutes, and in that all the applicants who are invited that day are invited. So it is not possible to get all the questions out. Would you suggest reaching out to them to ask any specific questions? Okay.
Because that's the way you are showing more interest in their life, in their program. So if I would a resident, if someone is asking me about my residency experience, so I would definitely remember that candidate, that was a good candidate. I would definitely like give some insight to my program about the candidate.
Although resident, they don't put any scores.
Yeah.
In the
Right.
resident
Yeah.
meet, you are not judged. Okay.
Yeah.
No one is analyzing you in your resident meet, but it's just your way of knowing the program.
Right.
Residents, they might program director will definitely appreciate their own program.
Mm-hmm.
But it's the resident who will tell you the reality that what
Because
they are facing.
residents would be there just for the couple of years, but program director would be the same. So asking the residents is the reality of the program.
Yeah, this is how you come to know that how is the place how is the work schedule, how is the per cap and everything.
Yeah, like we are living just 10 minutes far from the hospital. So that's all you can gather the information. Like how
Right.
far is the hospital, where which community is better to stay at.
I would even ask a silly question like, is there an Asian store? Because we are
Yeah.
Asians and we are definitely foodies.
And
So
it's
you
an
can ask
important
anything.
question.
You can ask anything that what is there around. This is my hobby. Is there anything like this interesting around? You know.
Like after completing your day at hospital, you would definitely go for some food, some good grocery stores, everything you would ask for. So that's a good way.
And how would you suggest that one reaches out to them post interview? Um,
Yeah, I think they are open with the emails and
So we give thank you. We send them thank you emails. We also personally sent mails last year.
right.
But I think in the COVID times, they might not even open your mails over here in United States. So better you can send thank you email. That's fine. But you should send them to
emails. Yeah.
all the attendings you interviewed with.
Right.
And
Or
you
else,
should it should be
yeah.
short, mentioning your date, when did you interview, and if any memorable conversation, some funny moments that you can mention it. And last paragraph should be how you enjoyed interviewing them, and why do you think that you will rank that program high. So 2 to 3 reasons. That's how I would close my email.
And if you have forgotten to ask the emails, and you can always email the program coordinator. He or she can provide you the email.
So make sure that while you are interviewing, the one who coordinates everything, program coordinator, you ask them the email of all the three, attendings whom you interviewed.
Attendings or residents,
Yeah.
whomsoever you like. Yeah.
So, I mean, it's not frowned upon.
No, not at all.
Okay. Okay.
No.
And that is reassuring to know.
Yeah, they
And
might not, the thing is, if they are busy, they might not open your thank you email.
right.
But the other advantage is they will consider the emails of all those who interviewed them.
Right.
Our emails, they are considered over those candidates who are not
Because
interviewed.
if we both of us are being given invitations, so they would definitely like keep us in high priority in seeing our emails,
Yes.
replying to our emails. So it's always the better.
So mostly they will open your email.
Like it's not harmful to send an email just like waiting for their reply.
They won't reply you. Don't expect that. But it's
always
good to send
yeah.
it.
Yeah. So, okay, one can send it without the expectation of a reply.
And make sure that while you send the email, you prepare your signature. They call it signature, the last.
In the
Mhm.
like Gmail section, you can make your own signature, like Dr. Parth Verma.
And put your photograph, Ira's photograph.
Like
In the
you can-
signature.
Signature.
Yeah, that's how they will remember you, I guess.
Oh,
So we
okay.
had made such kind of email signature. So in whichever program we interviewed with, we used to send them the emails, and they would know all of our information just from the signature, our photo, name, and double AMC ID and contact details. Yeah.
That is very useful information because I think a lot of people do not know this, and
Yeah.
specifically they don't know how to put the picture.
The emails that we receive from the programs, they usually have the name of the program coordinator or everything in the
Yeah.
signature section.
And always proofread your email 2 times before sending anyone, and make sure to check it with Grammarly.
Right.
Subscribe Grammarly, not the free one.
Yeah, the paid version of it.
Yes.
True, true. And what would you say? Like, we know that individually, when one is interviewing with, say, 4 to 5 attendings or 3 or 4 attendings, how do you stand out in the waiting room sessions when you're with the students? Does that matter? Does it not matter?
You should interact with the students.
Mhm.
Like, hi, how are you? If it's any ongoing fall season.
Yeah, because
Yeah.
all of the applicants are in different situations. Like some of them would be interviewing from their home country, some of them would be in the like US itself. So you can ask like, how is the weather right now over there?
Any casual
Yeah,
thing, like you
well-
are meeting someone for the first time.
Mhm.
What casual things you ask that? Oh, hi, where are you? How is it going for you? How is the season going?
Yeah, what are you doing right now? Are you preparing for some exams or doing some rotations? So that's how you can.
But you don't have to talk too much continuously. Just 2 to 3 things. It's okay.
Yeah. And how do you stay relevant after the interview? Like, how often should the letters be sent? What time should they be sent? Was there a strategy in your mind when you were sending it?
Letter of intent you send in February. Basically, intent is only to your number one choice,
Rank
Right.
order. Yeah.
and letter of intent is only to number one choice. But you can send to your 3 to 4
Yeah.
first 3 to 4 programs.
Mhm.
You shouldn't mention intent over there because they are not number one. They are 2 to 3 and 4. You should just say.
But we
Letter of-
would definitely write that to our number one choice that we are ranking you the number one. So if it is good for you, then you can rank us higher as well. And another thing that after each interview, we used to send thank you emails to each programs.
And also we updated
Yeah.
step 3.
Yes.
So that's how you stay in communication with them.
So-
If you have any recent updates, you should email them that this is my so and so
So
update.
because some of the people might not get like a letter of recommendations on time. So if they submit their ERAS CV before the letter of like LOR receiving, then you should email them that I have got my LOR, I have uploaded it to my CV. So just kindly check.
Yeah,
that
so
out.
in case if you don't have your LOR on time, you should update them.
So I think we had sent a few of the letter of interest during October time. Then after thank you emails after interviews and letter of intent before
In February,
list. Yeah.
Jan or Feb.
Right, because I think some of the applicants might have already started giving interviews, and until February, the programs would have already interviewed about more than 100 applicants. So that is useful advice. If there's any update, one can do it.
I had a good experience last year that we also apply to pre-match programs. I think many of the IMGs also apply to pre-match programs. So sending them letter of interest before they send out the interviews is a good idea because they fill their pre-match seats earlier than the match season. So I had sent them letter of interest like in October time, and they replied me that we have already sent all the invitations. So for if you are interested in pre-match program, then should go for sending them out letter of interest earlier than the rest programs.
Right. Yeah. And especially now this season, I think I am even Psych. I only know these two. They're incredibly competitive with a lot of IMGs still not having received. Um, I think some of them have received very few interviews. Some of them have not received them as of yet. Would you suggest sending them LOIs now? And how many times?
You can send them like every 20 days.
Okay.
Yes.
Would
Now is the right time because most of them, they are reviewing your application. Most of them, they are sending interviews or they have sent out interviews already.
Yeah, because I think a common theory in most of the forums right now is whether this is the panic date or whether we should postpone the panic date. So
more like individual basis. Some of them used to email the programs in the first week after the interview application, and some of them after 1 month of application. So it depends on the applicants as well.
yeah, I think the common this thing is that one does not want to be very annoying also.
Yeah.
No, but the thing is, it's better to be annoying than to be
True.
ignored at
No,
all.
but if you are already been told from the program that don't send out the letter of interest, then you should not.
If they've already replied you that we are done now, most few of them will reply you that we are done with the interviews now. We won't be able to send you, then you should stop.
And I think you should also go on checking for spam folders and everywhere, because some of them come via Thalamus, some of them via ERAS, and some of them just by Gmail. So always check.
And I would also say that now, or I think we started it in July. If you have any known in any residency program, start contacting them. They can put in good words about you. It matters a lot. A resident or an attending recommend you in the program. It actually has a great say,
So, it's all making connections during your match season. But earlier is the better one, because if you approach some resident in this time, October, November, then they have no place to.
Because every resident can only give 2 names, not more than 2. So I think by now they might have already given 2 names, including us. We have given already 2 names. So that's why I told that we had started making contacts in July before the match season, that book my name, you should say. So you start making contacts.
Yeah, so as soon as we
As many
receive-
as people working in a
Yeah.
residency program. So that's
How
the
do you like? For, I don't know about your contacts, but like majority of a lot of people would not have any close friend or someone in the program. Suppose they've done a rotation at some place. How do you approach them and tell them to vouch for you?
So basically, if you work with someone in a rotation, they
Mm-hmm.
found your work nice, they found working with you very nice, then on the last day, you can request them.
Right.
Do you have any suggestions for me? If you really liked working with me, is it possible to put in good words for me? Like that.
Mm-hmm.
You should send them your CV,
Right.
because some of them, they might not be knowing you. So you should send some of the, documentation that this is what I did, this is my profile. So
Mhm.
that's how you can ask them to do it. And also, not everyone can do that for you. Some of them will deny, but that's okay. It's
Yeah,
just a
but
trial and
yeah,
error,
don't get discouraged because of that denial, because you will find some kind of denials everywhere. So
because even there is a limitation for them. They cannot give more than 2.
and if you receive some early denial, then it's better than just fake approval.
Yes, some people will say that, okay, I'll recommend you, but they might not have recommended you at all. So
Right. Yeah.
the company is very clear, and they are saying that we might not be able to do that. Sorry. So be
Yeah.
ready for anything.
Yeah. I mean, it's always better to ask. I mean, the worst thing that can happen is that someone will say no to us.
Yeah.
True. True. And would you say, since there was also some talk about pre-match, what is your view on a pre-match program versus a match program?
So I would say, like, if you are liking the place and program, and if you have any connections to the program, you can ask for the like atmosphere, how good is the program is, how are the chances to get into fellowship. If you are planning for fellowships, then it pre-match is also fine, I
So the
guess.
only thing is that once you get a pre-match offer, pre-match program, if they provide you interview, they will tell you within 2 days
Right
of
away, yeah.
within 2 days of the interview, they will tell you that whether we liked you or not. So then you will have to make a decision within 2 days, and it will be a big confusion, because already if you have interviews from good places better than this, then you won't find it comfortable, giving up all the good programs over this. So
Right.
sometimes pre-matches, they might be an average program,
Yeah.
but it's a tough decision, but you have to make it, that you want an assurity. You are sure that you might not match at different other places. This is the only one, I think you are comfortable with, city wise and everything. So
Yeah.
basically, there is no difference in the training purpose. It
Mm-hmm.
just depends on what you like about the program, and are you ready to give up all other programs for this.
But
Yeah.
that's also a reality that even after you interview at very good programs, you may not be the candidate that they are looking for. So if you are getting good visa that you always wanted for, if you are getting good people to
In a
work with,
pre-match,
yeah, in a
then it's
pre-match,
fine to
yeah.
take pre-match. Many people, they do it. Most of them, they
If
do it
I would
actually.
have, we would have got pre-match, I would have selected
Most
that.
of the people, they say yes to their pre-match because it's an assurity, before March. Believe me, waiting for March is really a big thing.
It
I
is
mean,
a safety
you are
net.
in you are in like middle of the ocean and the seashore. So it's like you are stuck in between. You are nowhere. So if someone is saying you that, I'm hiring you from tomorrow,
Yeah.
start working on your visa, then I don't think anyone would say no. So it's a trap, and you will definitely fall, but it's worth doing. I mean, it's fine. So
Yeah. I don't think anyone, very few people, if any, would refuse it.
yeah, no,
Yeah.
mostly no one does that. So
But if you are like getting more than 20 interviews, then people do that because there are more chances of going into a good program rather
yeah,
than
so
that.
they basically
But
depends on.
but the pre-match program are also smarter than us. So they would ask you the number of interviews that you have received so far. So if you tell them I have received just 5 interviews, then they would offer you the pre-match because they know that you are going into that trap compared to the people who receive 20 interviews. So yeah.
Are they allowed to ask us how many interviews?
It depends on us if we are free to tell the number to
No,
them.
no, they can ask you.
Mm-hmm.
Few of them, they asked me as well.
Mm-hmm.
But you can give. It's not necessary that you tell them the real number.
Right.
You can make the program feel that, I just got interviews from 2 to 3 programs.
Mm-hmm.
then the program will think that, okay, there are chances that this candidate may rank me higher.
But you should
Yeah.
not like completely tell a
You
lie.
shouldn't say 0. You should say 1 to 2 or 2 to 3. But you shouldn't say 10. If you say 10, then the program will think that, okay, I might be the 10th for him.
Right.
You don't want to make anyone feel, low priority. So that's the thing.
If you are willing to go to that program.
Yes. Even if you are not willing, but you shouldn't say 10 or 20. That's too much. The program will come to know that I'm nothing for for this.
Yeah, because I was
Also ask you
reading.
that from where did you get interviews? So that's how the program will judge that where am I in her rank order list. The program will come to know that if you are saying I got interviews from Texas, from California, then the program in New York will come to know that, okay, she's not coming here. Of course she's going to Texas.
And
So
another
that's
thing
how.
is that if you are receiving 2 or more interviews in the same state, then also they would come to know that he or she would not come to my
So
program.
whenever they ask you such questions, you have to be very non-judgmental. I got 1 to 2 from, if you are interviewing in Texas, you must say I got interviews from NJNY, but I don't prefer to be there. I like the Texas weather because I come from, for example, I come from India, which shares a similar atmosphere as Texas. So I would definitely want to be here. That should be your interview answer. That why this program.
Yeah, I guess anything that is telling them that we are definitely looking to come to your program.
Exactly.
That makes a difference.
So
I
it's the
asked
same
about.
thing just for us, as we think that the program should like us. Similarly, the program also wants us to like them.
Right, of course. Yeah,
So,
because I think it's a like everyone says, it's a dating game.
yes,
Not
it is.
like that. So I
Right.
asked for the match. I'm sorry.
That's why the name is match.
Yes. I asked about the match violation question because I read about a couple of candidates being receiving a violation this season. Because program asked them, how many questions, like how many programs did they receive an interview from? I don't know if they mentioned the name of the programs they probably received an interview from. So
Oh, that's not allowed. I didn't know that.
even I'm not very aware of that. So that is one thing. Okay. And another thing that comes to mind now, which I can ask you both, is that you mentioned that time and money to establish yourself, especially, your practice in India was obviously very intensive. Like both a lot of time also goes into it and a lot of money is also invested into it. How much of that is taken into account in the US? How long does it take to actually establish yourself?
So, like, you know what the main advantage is? You won't
Mhm.
believe it, but from second year, I'm eligible to apply for a job.
Wow.
And by the time I start my third year, I can get a job established in United States. And they offer me initial amount. So apart from my residency stipend, they'll start paying me monthly some amount.
Is
For
this
staying
what
there.
is this what is called moonlighting?
No.
No. Okay.
This is the job which I'll do after my third year.
Wow.
Irrespective of my that exam, which what they call it, board exams.
Mhm.
The board exams I may take it anytime within 7 years of my residency. But I get a secured job, and that job
Like
for
the same
it
way,
varies. It varies according to specialty, the salary and everything. But it is about $2 lakh annually.
Wow.
Yeah. So it's a security over here. You get a job security basically.
yeah. So
Yeah.
by the end of third, like before mid of your third year of residency in internal medicine, you would be getting a surety about your fellowships
Yes.
and jobs.
Yeah. So which I think in my home country, after I passed my residency, I didn't find any job. So the only thing which I did was to be a senior resident in my own medical college. Just a senior resident with a basic pay scale. And I would strive hard to find a job as a dermatologist and he as an ophthalmologist.
Right.
It was really tough back there in
Yeah,
India.
so in
And no
India,
one would offer us like perfect salary. It's just we are compromising by working more. That's what I found in
in
India.
India, most of the hospitals don't hire dermatologists and mostly they are outpatient separate. Yes. Private thing.
Mm-hmm.
And I was trying through many like all those hiring websites in India as well, but none of them offered me more than maximum 1.5 lakh per month. Maximum, that was the thing. And in that too, I'm working under someone or something like that. So
No.
it's really tough. Back even in getting government job is hard in India right now.
Yes, definitely.
You have to be a senior resident for 1 year, and
Mm-hmm.
then only if the positions are available, and even there you will have to face interviews, and reservation systems would come even in those, associate professor, assistant professor, they will also have some reservation and everything, and then only you will be eligible to become a professor. So I
Right.
found it more tougher than this. So
No, actually, I don't think like all of us, we know the fact that, okay, to get into residency, this is what has to be done. And then you know that you have to apply for fellowship. I don't think as applicants, we are very aware of the fact that after this, you get a security or an
yes,
assurance of job,
exactly.
which
Yeah,
is very reassuring to hear.
exactly.
Yeah.
It is basically your struggle is only till you match. So after you match, everything is better. Just that you have to work more. That's the first year is hard, definitely. As an intern, that is first year residence, you have to work more.
Like
But
besides working more, you are adjusting to a new
so
atmosphere, new
first year is
people.
definitely hard. Second, third year, your rotations will be lighter. So even your residency will just feel like any job in second, third year. You'll get weekends off, entire weekend off. So
So the maximum work goes into the first or the intern year. Mhm.
intern, yes.
What would be your advice to incoming interns? What would you want them to know?
So you just enjoy your life. Believe me, intern year is hard. It's a lot of work. So you, wherever you are, if you are in United States or you are in your home country, I must say, you spend maximum time with your family. Work hard for your, if you're not done your step 3, finish it as soon as possible. You won't like to study
Yeah.
for that after you become a resident. It's very tough to read for step 3. Finish it off. Make trips as many as you can, monthly trips. Eat as much as you want your home country food. Enjoy all the festivals. You will definitely miss them over here very much. Your family, your festivals, food. You will have to cook yourself over here. So it's definitely tough, but it's worth doing. I mean, that's not an issue.
I understand that. I think that's very valuable because a lot of like I think as applicants, something that even you would have faced is you're always in that race. You have to
Yes,
do
we're
everything
already
to this,
always. So
that.
even right now also we are in the race. We just gave our in training exam before 1 month.
Oh.
So will have to give exams every year. It's
Mhm.
just for your evaluation. You don't. It's not like steps that they will pass you or fail you, but it's just they're evaluating you.
So
It's a
yeah.
7-hour exam basically,
So
like step.
you will be tested every day, every month in your residency. So whatever she is saying is I agree to, because your day of enjoyment will work on the first day of your residency.
Yeah,
Right.
so that's the thing basically. There are
And
challenges even in residency.
mhm.
Because definitely it's internal medicine. It's a challenging branch.
It's a vast branch.
It's a vast branch. You are dealing with everything. Being an internal medicine resident, you are also dealing with all the subspecialties like cardio, nephro, social service. There are placements into nursing home, rehab. There is a lot going on as an internal medicine.
Yeah.
So it's a learning curve basically coming to the EMR system and lot of documentation.
And even if like you are in United States and you have already used an EMR system, but there are different EMR for different hospitals. So that is no any universal EMR that
Mm.
everyone is using. So you have to get adjusted to the EMR system as
Yeah,
well.
that's not hard, but just the documentation is intense. So, but you will adjust to it also. For
I can
sure.
imagine. I think
Yeah.
also for the EMR that during rotations we only know the aspect of this is the EMR and
Mhm.
probably how to enter orders. But I as residents, I think you have to enter a lot more, like going to conferences and uh,
Yes, yes,
thinking about your PTOs and all of that. So I think yeah, okay, that is. Thank you for that good advice and
yes.
very valuable advice, which all of us will keep in mind that we need to
This is
implement.
the golden time, believe me.
Yes.
Definitely, the you will enjoy after you match, but you will become very busy after March
Right.
because you have to get your state license, and it's a very lengthy process. Even though you are in home country, you match, you will forget that you matched. You'll be busy in some other stuffs like documentation, visa applying.
Then this hospital documents, then after you start exploring the flight tickets, housing, everything you would start from your home country.
We were very busy after March. We forgot that we matched,
Wow.
So that's the
And
thing.
did you both have any backup plan? Like, what was your plan had you not matched?
So I think if we didn't match, we would
Dermatology, ophthalmology.
no, we would apply for the second year, but we would make our profile more stronger by doing more rotations and making more contacts, preferably.
Research.
Step 3, research and contacts. And even after second match, if we didn't match, second try, then
Right.
take admissions into like MPH or some other course, that also
Right.
that is also a good point. If you are not doing it well for 1 to 2 match cycle,
Mm-hmm.
then getting an MPH degree is a plus point.
Anything? Why specifically MPH? Just
So we have seen during our rotations that people here consider US college degree more compared to Indian or any home country degree.
So basically, you are a US graduate if you are MPH. You got a degree from United States. So that's a plus point.
right. And do you think MPH will also help in terms of the research aspect of it?
Yes.
That makes sense.
And
So
you will make contacts even while doing MPH, because you might work with some clinician, some attending. You might collaborate with some attending doing research. So if they are working in a program, they might put in good words for you. So that's a good way of making contacts.
yeah. Thank you so much, both of you. Just one last question before we call it off. Um, what's your plan now that you're in internal medicine? Firstly, how has that switch been? Was it easy? Were you
For
prepared
me,
for
it's definitely hard because we both are coming from a specialized branch into a broad branch.
it?
So it's definitely because we were used to just looking at one thing, like just the skin, him just the eyes. So now, as I said, internal medicine, we are looking into everything, like kidney numbers, liver numbers.
That's what we always wanted, right?
Yeah, that's what you say in your interviews, but then doing that,
Right.
it's challenging. But yeah, that was hard for me. As per now, I'm doing everything. I find that if I do a super specialty, I'll be more focused into one thing, just like dermat.
Mm-hmm.
So but right now I'm also tired of doing another fellowship again for 3 years. So I might be a hospitalist, because
Okay.
in hospitalist, like, you get 2 weeks off, 2 weeks on job. You don't work. You might be knowing that, right? You
Yeah,
don't
I've heard about it.
Yeah. So you don't work daily as a hospitalist. So if you want to have a cooler work schedule, you want to enjoy your life more, then you
Right.
be a hospitalist. But while in the hospital, you'll be dealing with all the stuffs. But if you are a super specialist, then you don't have such, leave schedule. As a super specialist, you will have your own private practice. You will also be affiliated to 2 or more hospitals. But your notes and everything will be very precise, very short. As a
Right.
super specialist, you just look at your system, put a very quick short note, and you get out of the hospital, and you earn more money. You earn more money per notes.
Oh, you earn per notes.
Yeah, the attendings over here, they earn per notes if they are private practitioner. But if
Okay.
you are a hospitalist, then you get a fixed pay. So that's how my plan is.
Yeah, I'm still looking for some fellowship options, but as I'm like new to the internal medicine, still figuring it out.
So we basically get rotations in all the subspecialties during our
electives,
residency. So
Right.
that's how we can figure out that what we are liking.
True.
They give us in hemong, cardiology 1 month, nephro 1 month. So
Yeah.
that we can figure it out,
Yeah, I think like after this year, and by the time you approach the time to when once you get closer to the time for applying to fellowships, you would have probably more better
Yes.
idea.
Yeah.
Yeah. Hmm. Okay.
You get
And
exposure. Yeah, first, yeah.
absolutely, I think it's very good here, especially in the US, that you get that kind of exposure.
Mhm.
In the system in terms of, med students getting to choose their course and then their electives. So that sort of helps orient them towards their interests. So that is a good system here. And is there couples match for fellowship as well?
I have no idea about that,
Okay.
but I think it is similar to this Erasmus season, so it should
Mhm.
be. But we are not sure, and we have not seen
I
it.
have heard that if one of them are getting a fellowship option, then they are also open for a like job for her hospitalist.
Oh,
So
okay.
Like he
open
can
for-
put in words that if I get matched, then is there a spot available as a hospitalist for my wife? Then they
Okay,
might
perfect.
consider it. Or you might interview in the same city with some other hospital. Like
Right, right. Okay.
yeah.
Well, thank you very much, Dr. Prachi, and thank you, Dr. Parth.
Okay.
It was a very insightful session in a lot of things. Firstly, the couple match. Secondly, I think you have a lot more insight on the workings of the system now that you have crossed over to that side. And I think for any of us who want to reach out to you, what would be the best way to reach out to you?
Yeah, I have my Instagram page. I think I shared it with you.
Right.
I think I can. Is there a chat option?
Yes, there is.
Let me write my Instagram and my YouTube channel over there.
And did we answer everyone? Like, I think there are many questions in chat, or everything is done.
No, you answered all the questions. A lot of them, by the time they would ask the question, you would have already answered it. So I think
How many of them were there today? I mean, I couldn't see. So
and we
what
will.
is YouTube channel actually? I'll try to follow.
It's Humans of USMLE.
Okay, humans of USMLE. Okay, I'll
Yes,
try to follow that. And
perfect.
you all are match applicants, or you are like in
We
different?
are
You are
all
age
like
preparation.
most of us are match applicants. Like the team is basically because of Dr. Mansoori, it is his platform, but we are an organizing committee, and we are 5 of us who are all match applicants this season.
Okay, best of luck, everyone.
Yeah,
Thank
best
you so much.
I think you got my Instagram as well as YouTube, right? So I am uploading few contents. I'm sharing my experience on this Instagram as well as YouTube.
Yes, perfect.
Any specific topics, then let me know. I'll put a post or I'll share a video on that.
Thank you so much. Thank you very much. That was a very candid session. You both took. I know it's very hectic as an intern in a first year to come on these sessions. So thank you very much. We really appreciate it. Most of our viewers are, I think, in India, Pakistan, and the that part of the world. So it's very early in the morning for them.
Really, you're waiting. You got up early for us.
No, I am in the US, but one of my co-moderators is in India. So she's
Okay.
also here. But
I just read that someone mentioned that it's 5 a.m. in India.
yes.
Oh, okay. Well, thank you so much.
Yeah.
I would never wake up, So, but really, thank you so much for coming up. And you can ask us any question if you want to have another session with few questions. And we are also doing mock sessions. So any of us.
Someone mentioned we don't sleep.
That is Dr. Isha. She's also
miss sleeping, so you should sleep.
she's also one of our core executive members. So thank you very much, both of you. It has been a pleasure to host you. And we will be having sessions in the future. We will also mention when we upload the recording, we will also mention your Instagram and YouTube handles. I think
Yes.
it will make it easier for everyone to get in touch with you directly. Thank you so much.
Thank you so much, and best of luck, everyone.
Yeah,
Okay.
best wishes. Bye.
Yeah.
Thank
Bye.
you. Thank you, everyone. That was the last session for the day. And we will be uploading the sessions over YouTube. Thank you.